The United States government built the perfect fraud machine. Every president struggles to fix the Medicare fraud system. For decades, politicians promised to crack down on Medicare fraud. Every administration repeats the same public promise. Find the waste inside Medicare. Stop the abuse across the healthcare system. Protect taxpayers from fraudulent medical payments. Yet billions of dollars keep leaving the system. Improper payments move through Medicare year after year. Fraudulent claims continue reaching government payment systems. Organized scams keep exploiting healthcare programs. Why does this keep happening? Is the government simply incompetent? Are criminals becoming smarter than investigators? Or was Medicare built to make fraud almost impossible to eliminate? Pause on a stack of Medicare claim forms. What if Medicare did not fail? What if Medicare performs exactly as designed? What if fraud is the price of making Medicare work? Medicare began in 1965 with a simple goal. The goal was healthcare access for older Americans. The program expanded rapidly across the United States. Millions of patients became tens of millions. Doctors entered a growing national healthcare network. Hospitals entered the same expanding Medicare system. Pharmacies became part of the national payment chain. Laboratories joined the Medicare claims network. Medical suppliers entered the healthcare billing system. Insurance contractors became part of the Medicare machine. Together, they formed a vast national healthcare network. Today, Medicare processes hundreds of millions of claims each year. The scale of the system is staggering, but massive scale creates a massive problem. How can every claim be verified? How can every procedure be confirmed? How can every provider be checked? How can every scam be stopped? The larger the system becomes, the harder verification becomes. That challenge shaped everything that followed. Most people assume criminals simply discovered Medicare's weaknesses. But government watchdogs warned the vulnerability may be much deeper. The Government Accountability Office classified Medicare as high risk for decades. Not because fraud investigators are lazy, not because policymakers are unaware, but because Medicare's structure creates vulnerabilities. Millions of claims move through the system. Providers must be paid quickly. Patients need uninterrupted medical care. Claims are often processed electronically. Manual review of every claim would be prohibitively expensive. Manual review of every claim would be painfully slow. In other words, Medicare was optimized for speed. Every system optimized for speed creates opportunities for abuse. Pause on a computer screen processing medical claims. The conventional political story is simple. Fraud exists because government failed. The solution is tougher enforcement. The solution is more audits. The solution is more prosecutions. The solution is more investigations. But congressional hearings tell a more complicated story. Watchdog reports tell a more complicated story. Program integrity reviews tell a more complicated story. Policymakers were repeatedly warned about prepayment verification. Verifying every claim before payment was not realistic. The volume of claims was simply too large. The cost of full verification was too high. The delays would be too disruptive. The result was an implicit bargain. It was not a formal vote. It was not a public declaration. It was a practical reality. A system serving millions would prioritize access and speed. That same system would accept some fraudulent claims. Some fraudulent claims would inevitably get through. The goal was not eliminating fraud. The goal was managing fraud. Pause on Congress, claim forms, and hospital waiting rooms. At first glance, Medicare looks like an American problem. But Medicare fraud is not only an American problem. Countries with very different healthcare systems face similar challenges. The United Kingdom faces verification challenges. Canada faces healthcare fraud challenges. France faces improper payment challenges. Germany faces healthcare system vulnerabilities. Australia faces similar fraud and verification pressures. Different governments confront the same problem. Different funding models confront the same problem. Different political philosophies confront the same problem. Yet all struggle with fraud and improper payments. All struggle with verification challenges at scale. None chose exhaustive, claim-by-claim verification. Instead, nearly all rely on a similar strategy. They rely on fast payment. They rely on targeted audits. They rely on data analytics. They rely on post-payment reviews. They rely on risk management. The global pattern suggests something important. The problem may not be uniquely American. The problem may appear wherever large healthcare systems serve millions. Pause on a world map of healthcare systems. Politicians often promise to eliminate fraud, but experts rarely speak that way. Government auditors acknowledge some fraud will evade detection. Economists warn that tighter controls create new costs. Providers can face payment delays. Administrative burdens can increase. Patient access can suffer. The reality is uncomfortable. Fraud is not simply a criminal problem. Fraud is also a systems problem. Scale creates part of the challenge. Complexity creates part of the challenge. Incentives create part of the challenge. Human behavior creates part of the challenge. That means there may be no perfect solution. At least, past tools offered no perfect solution. Pause on investigators surrounded by records and computer screens. For decades, one assumption shaped the entire debate. Humans could not verify everything. There were simply too many claims. There were too many transactions. There were too many records. There were too many providers. But artificial intelligence is beginning to challenge that assumption. For the first time, governments can imagine new systems. These systems could analyze millions of transactions simultaneously. Artificial intelligence could identify unusual patterns. Artificial intelligence could connect hidden relationships. Artificial intelligence could detect anomalies. Artificial intelligence could find invisible links. Those links would have escaped human investigators. Perhaps AI's greatest contribution is not catching every fraudulent claim. Perhaps AI helps governments connect dots across vast systems. Perhaps AI reveals patterns previously impossible to see. Pause on data streams forming a healthcare fraud map. For decades, Medicare fraud existed for one core reason. Verifying millions of claims was beyond human capacity. Policymakers accepted a difficult reality. The faster a system moved, the harder verification became. Every transaction could not be checked. But that assumption may be starting to change. Governments may finally connect enormous amounts of information. Governments may analyze enormous information in real time. Could large-scale fraud become dramatically harder to hide? But that possibility raises another question. Pause on cameras, servers, citizens, and government buildings. Artificial intelligence could give governments unprecedented financial visibility. Artificial intelligence could reveal patterns in human behavior. How much surveillance will citizens accept? How much privacy will citizens trade to reduce fraud? The future of Medicare fraud may not be about healthcare. It may be about artificial intelligence. It may be about privacy. It may be about governance. It may be about citizens and the state. That is a documentary for another day.